Okay, Maximility fam, welcome to our first episode here with David PT, one of our own. If you haven't seen him yet in the morning classes, been around a couple months.
Yeah.
But he's going to give us some things. We're going to start with the shoulder this week and hopefully dive into a couple more things. But a little self-evaluation we can do.
Yeah, guys. So this is just a good overall self-assessment from home. I know a lot of people got shoulder issues from previous injuries or just overwork sometimes, and so hopefully you can use this assessment to figure out a little bit more about some of the discomfort in your shoulder. I know a lot of times people feel their pain or their discomfort is a little bit random, but when you're going through this self-assessment, write down what bothers you, and this way when you're in a workout you can kind of get to know, hey, okay, I have trouble going overhead, I have trouble with internal rotation, maybe I need to modify something in my workout. At the end of this, I'm going to go over a couple exercises, drills, or some of the more common things that we see with shoulder discomfort, but first we're going to get started with some assessment. So find a wall. Tim's going to jump on the wall here. We're going to start with flexion, so we're going to bring hands up overhead, and you're going to reach back with thumbs here. You're going to try to touch the wall. If thumbs can touch the wall, you get good shoulder overhead. If you're having any discomfort, write it down. One of the things we're looking for here is back should stay flat against the wall. As you're doing this, if you notice back is arching off, just make a little note of it. Good. Next, we're going to bring arms down by side. We're coming out up to the side. You should be able to slide the arms along the wall here. It's getting a little tight for Tim. And try to come all the way overhead. Keep going, keep going, keep going. It gets nice and tight there. If you feel arms coming up overhead, coming up off the wall as you're going up overhead, again, just make a little note of it. This is going to give you an idea of what's restricted and what's limited. Next, we're going to jump on the floor here for a couple. Maybe on your stomach. We're going to start on the stomach. And it's going to go through some extensions. So you're going to bring arms, you're kind of in that push-up position here. Make a little fist like you're doing perfect. And you're going to try from this position, you're going to try to lift those elbows up off the ground. You should be able to clear by about an inch and back down. If you feel yourself arching chest up off the ground to get the rate, that'll make it a lot easier. That's not what you're looking for. This should be a pure shoulder motion as you're doing it. If you feel like you can't get arms up off the ground, you're going to have some tightness restriction through the front. All right, flip on the back. Next, we're gonna check out now some internal external rotation. So from this position, arms are gonna come out to about 90 degrees abduction. You see Tim's here. We're gonna bring arms back, and thumb is gonna try to touch the ground then. Again, if you feel back arching up, just make a note of it. That's gonna let you know you have some restriction in that area. Good. Now as we're coming down, we're gonna come into internal rotation. With internal rotation, one of the things you wanna look for is that shoulder popping up off the ground. That shoulder should stay down on the ground the whole time. When you feel like you've reached that limit, you're going to bring your hand in. If you can touch kind of the midline of your rib cage, you're pretty good internal rotation. If you feel like you're pretty high up, you're touching more in the pec area, you're pretty limited in internal rotation. Just mark it down. Let yourself know you're limited in internal rotation. All right. Come on, let's go through some exercises now. I'm going to go through some of the more common ones. Some of the things I pretty much see all the time are limited overhead range, limited internal rotation, or some of that extension, maybe some from the shoulder discomfort as well. And so if you noticed any of that stuff going through that self-assessment, follow along with these exercises. So if you had limited overhead range, we'll start there. A lot of times that can be caused by lat tightness, so we're going to get into a banded lat stretch here. Yep, you're going to loop that band around the wrist, sit your hips back. Good, and just find a nice stretch position here. Yeah, you can move hips around a little bit. Good. And you're holding that about 10, 20, 30 seconds. Breathe as you're doing it. Good. And then we're going to slide the bench out here. If you noticed you were tight in external rotation and overhead, this is going to be a great stretch for you. You're going to get on the bar, you're going to bring those arms externally, rotate a little bit to fire up the cuffs. You're going to be kneeling. You're going to get a nice reach down, bending those elbows forward and back. breathing at that bottom position. Really try to get that rib cage to expand. Good. And I usually rep through about 5 or 10. Again, you don't need to be crushing these things. You're not trying to really crank through any pain ever. It's just if you notice some limitations, a little bit of discomfort, these can be good things to help you regain some of that range of motion.
I'll start with like a regular grip, and then once I get into it, then I'll start scooting it out a little bit.
Yeah, exactly. You don't have to start all the way you're in range. You just have something in the middle there, work your way out. Next, we're going to go through some foam roller. Anytime I see tightness overhead, one of the areas we look into is thoracic spine. And so for T-spine, we're going to get that roller right to the middle of the back. You're going to bring hips up, yep, and just rolling up and down. I'll go through about 5, 10 of those. And then you're going to pin it right at the bottom of the shoulder blades. So scoot back a little bit, back a little bit, back a little bit. Hips stay down, and you're going to arch over. You're going to get a couple arches over again.
Oh, just out of bed.
Yeah. With any overhead tightness, a lot of times people are going to have mid-back stiffness, and so this is a really good exercise drill just to kind of get in. Honestly, I do it daily. It feels pretty good. Most people, even if you don't have overhead stiffness, it feels pretty good. Yeah. And then the other thing that we see with overhead restriction is restriction in thoracic spine rotation. So we're going to bring the roller down here.
Legs?
Yeah, you're going to be laying on your side.
This?
Yep. And then, front knee is going to bring it in front here. Front knee is going to be bent. Top knee is going to be bent here. Bring that up, bottom leg straight. You're going to reach in front of you with both hands. Bring both hands right here. Good. And then open up from that hand. Keeping the knee down on the roller here. If you feel knee is starting to pop up off, you're getting into low back. That knee should stay down on the roller. That's going to keep this a mid-back exercise.
Oh, yeah. I like it.
Yeah, sounds good too. Nice crack.
Gives you a nice little target there to keep that.
All right. So if you had, if you felt limited in that extension coming up off the ground there, or with internal rotation coming down, these next couple are going to be for you. We're going to bring the roller, we're going to roll through the pec here, so you can get it kind of, aligned a little bit diagonal, arm is out to the side. And then you're going to bring your arm up and down. Yep. Pin down those tight areas of tissue. Move that arm up and down through. Once you find a tight band, a few times, I usually go 3, 4 times on spot, then move it around a little bit. And then we're going to grab the lacrosse ball. And this one's going to kind of suck a little bit. You're going to get it right into the back of the rotator cuff, right on the back of the shoulder blade here. And we're going to pin that ball on the cuff. You're going to be laying right there with that ball down. So you're going to come on down. You're going to find that spot on the cuff. You're going to pin it down. You're going to bring your elbow down to the ground here. And you're going to go through that internal, external rotation movement. Again, where the thumb is coming back down towards the ground. This can be pretty intense sometimes if you have a history of shoulder issues. Even if you don't, it can be a pretty intense spot. So usually 5 or 10 of them is fine.
Next.
Cool. Yeah,
that was good. Yeah, I've never done that.
Awesome. All right, so those are just a couple exercises you guys can get rolling on if you have any of that shoulder discomfort. Again, don't crank through pain with any of these things. This is for limitations in range of motion, some tightness. If you really have a hard stop where you're going, okay, that hurts, that's really painful, don't push through it. Tim's got my number. You know, you guys can come find me in the gym, reach out, Blue Iron Physio. I'm happy to help in any way I can. Just jump on a phone call with you guys and troubleshoot some stuff. If you have someone that you've worked with in the past and you want to, get on the phone with them, that's fine too. But just don't push through pain, because that's how you, make sure that you need to take 2 or 3 months off from the gym.
Thanks, David.
Yeah.
Let's be adults here. You know, you can't just keep on talking about the pain and whining about it. Let's dive in and see if we can figure out. You know, each of us are a little different. So here's a couple steps that we can take to figure out what's going on, and then address the situation, ask questions, reach out to David, and more videos to come.
Yeah. All right, guys.